Our platform serves as the backbone for data collection across over 450 amazing organizations. And since joining Motivity in 2016, I've been blessed to witness how our data collection platform has made the jobs of behavior analysts and technicians so much easier. If you're curious about the system, sign up for a demo on motivity.net, and I'll just put that in the chat for you. There. All right. Now, often Motivity provides CEUs for presentations on Behavior Live, but our future-focused presentations do not qualify. However, we are confident that your time will not be wasted. And one more thing I want to mention, if you would like for our presenter or a host to address something specifically or to answer your question, use the question button, not the chat function. You'll be able to vote for questions that you want to have answered if you don't have any of your own. But feel free to use the chat function to just chat. Now, I am excited to introduce Vijay Ravindran, founder of Floreo. And I've actually seen this device in action at conferences. It is so cool. A little info about Vijay before we get started. Following his time at Amazon.com and the Washington Post, Vijay's professional journey was guided by a personal mission. He founded Floreo, where he has leveraged his experience in building a new treatment modality for the neurodiverse using virtual reality. The Floreo system received FDA breakthrough device designation in 2023 and is in active use by over 100 healthcare providers and school districts. Now I'm going to turn you over to Brian Curley, Motivity's Chief Creative Officer, who will be your host. Take it away, Brian.
Thank you, Christy, and welcome to Future Focus. As Christy said, this is a webinar series to kind of shine a light on some of the amazing pieces of technology that have surfaced over the last few years in the ABA market, and we want this to be kind of a long-form way for people to hear about these companies, hear about their journey, and discuss and communicate like their contributions to the ABA community with their software, giving them the ability to kind of dive deep into their backgrounds, their values, and their mission. So without further ado, Vijay, nice to meet you. Thanks for joining. Tell me a little bit about Floreo.
Yeah, no, first, thanks to Motivity for inviting me to speak and for all of you joining to hear more about the mission at Floreo and how we're trying to, really create something special to help raise the potential of every child receiving services. So, as Brian mentioned, Floreo starts from a really personal space. Like so many others, my life was changed when my son was diagnosed on the spectrum. And, he's been the beneficiary of thousands of hours of services, including ABA. And so, first of all, I'm always grateful when speaking to practitioners who are dedicating their careers to helping children like mine, because you're making a difference every day. And we're so humbled, given how challenging it is when you're on the family side of trying to help your child reach their full potential. I have some slides that I'm going to show just to give you a sense of what is Floreo, sure, how it can fit in. But let me just start with a story that Floreo starts from a really personal space. And it really started at my time at the Washington Post. In 2015, as I was starting to look at what's next, I had just worked on the transaction to sell the Washington Post to Jeff Bezos, which was a worlds colliding moment for me because I was an early engineer at Amazon, and Jeff had been a reference to the Graham family when I joined the Washington Post. And my son tried out VR for the first time, and he spent about 30 minutes in a virtual reality experience, and an amazing thing happened where he went down to his playroom and he started engaging with toys and pretend playing in a way I'd never seen before. And it ended up being a light bulb moment, for parents when you're in this kind of situation in the ladder and whether your child can climb up it. And it's so daunting. And it's something that, parents who don't have a neurodiverse child can often take for granted. But it was one of those moments that was special, and it led to this idea that could VR be a new medium for therapy and training for children like mine. So I'm going to share.
So how old was he? How old was he when he first put the first?
He was 6 years old.
About 6 years old.
Yeah.
Oh, okay. So at that time, was he already receiving treatment?
Yeah. So he had been receiving ABA and speech and OT for a number of years.
Oh, okay.
Yeah.
So yeah, let's share some slides and let's take a look at this thing.
So first, a little bit on Floreo. So what is it? It's a research-backed virtual reality platform where clinically designed content for helping with social and life skills can be delivered. Can be done both in person, in clinic, or as a telehealth-based service. And we have customers doing both today in the field. Our research has been recognized in a lot of different ways, but the one we're most proud of today is our FDA Breakthrough Device designation. This was based primarily on research we did with Cortica, a large ABA medical provider. And the results of that study that was run last year were used as part of our application to the FDA. We're in a larger pivotal trial today as we look to apply for full market clearance for the product. That's my son in the photo demonstrating one of the lessons in Floreo, and you can read more about the background of Floreo through our New York Times feature in 2022. But we're really excited about the space we're building for kids to be able to receive services. How Floreo works is that the child wears a virtual reality headset. We support several different models, and we support also leasing hardware to clinics who are looking to adopt our system. And while the child is wearing the headset, a supervising adult, such as an RBT or BCBA, or in a home deployment, a parent, is able to use a coaching application to be able to implement a lesson plan, be able to supervise a lesson that's being delivered on a particular skill. They can see everything the child is seeing from that coaching application, and they're able to orchestrate the lesson and record key data, with the end result being that the child is able to learn new skills in these virtual environments that has been shown through our research to then generalize back to the real world. And so we're going to do a demo of this in a moment so you can actually see it in action. But
yeah, that'd be great.
But basically, the Floreo system is really a two-component system. It's a virtual reality headset and the coaching app being used together. And that coaching app can be used as a telehealth application. So we have clinics today who are able to, combined with video conferencing and providing a VR headset to the family, be able to fill in those hours that you might wanting to be received for the child that are not logistically possible in clinic, and being able to do that using this modality. And
sure. But before we jump into this, I have a couple of questions more on like I guess on the coaching side. Like, have you introduced kind of like a new type of prompting now? Like, is there a new, like you can have a partial verbal, a full physical, like all these different types of prompts to get something achieved.
Yeah.
Now, what are these called? Is there a full visual prompt or something like a?
Because the RBT or BCBA is synchronously engaged the entire time, and the child is able to hear them verbally, practitioners continue prompting and recording their interactions with the child in the same way they would with other interventions or other ways of teaching a skill. So we have built the system to be compatible with the protocols that are followed by ABA therapists or speech therapists if it's being used in a speech context. And I tend to think about Floreo as an alternative to a plushy toy or a toy train or flashcards that you're using this highly immersive medium to convey a skill that maybe you'd be doing role playing or other types of play acting to kind of contrive the situation that you're trying to learn the skill around.
Sure. So is there a method of prompting within the system
that
you've built?
It's really flexible in how the coach, the therapist chooses to advance the lesson. So they are controlling, and some of this will be clear when we go through the demonstration, but they basically guide the pacing of the lesson. They make decisions on how much verbal coaching to deliver to the child before advancing. They also assess the quality of the responses of the child that can then be fed into calculations for mastery and such. And we do try to provide facilities so that data is collected in a manner that can be utilized for future treatment planning. And the system is designed with that BCBA RBT relationship in mind, so that the BCBA might be developing the lesson plan, the RBT might be implementing it in session. And so there's obviously a lot of back-end communication that needs to be facilitated as well.
Sure. And is this, you're only in VR right now, right? There's no pass-through mode doing any sort of AR, or is that something you're working on, or?
Yeah, great question. So the Floreo system is in VR today. There might be future applications that utilize AR. The technology is catching up, but it's still a few years away to have efficient and affordable solutions there.
Sure. Yeah, of course. Okay, cool. So yeah, let's
yeah. So
is demo next? Okay.
Yeah, well, in a moment, I'll just kind of quickly go through. So this is just a simple animated image of how a lesson might work. Child's in the headset practicing how to learn across the street. The therapist is using the iPad application to provide coaching to the child as they go through it. And in the real world, they might be taking those steps. Key to the Floreo experience is an ever-growing catalog of lessons, now over 200. So these are the things that can be incorporated into that treatment plan and mapped into it. And we're working on a lot of solutions that are coming up soon, including using AI to help facilitate finding the right lessons that can match the next challenges facing the child, so that BCBA can help determine the appropriate use of Floreo in the greater treatment plan. And
wow, so how do you go back? So like, so these scenes that you're creating, like, do you have a whole team that's putting these together? Like, how do these get originated and wireframed and storyboarded?
Yeah.
I can only imagine the amount of effort that must go into stuff like that.
Yeah, so we have a full both clinical and studio team that are working on designing these and implementing them. It includes people with BCBA, SLP backgrounds, as well as folks with lived experience as neurodiverse adults. And so we've built a great diverse team to conceive, design, implement, and then we obviously lean on our customers to help provide the feedback and the inspiration for the next set of lessons.
Sure. So are each one of these, are these kind of like a single video file, or is it kind of like a choose your own adventure type thing, to where there might be like 6
the therapist
that you would go down, or?
Yeah. Well, let's jump to the demo.
Okay.
So first, before I do that, I'm just going to quickly show a couple of things. So we support several different virtual reality headsets. The one used by most of our ABA clinic customers today is utilizing a smartphone, iPhone 8 or above. So I have one that's downloaded the Floreo app. I've selected the child I'm going to work with already, and it's now in a waiting mode. So you can see the left eye, right eye view. At this point, the phone can be placed into one of these inexpensive plastic headsets. It opens up, the phone is placed in, and then it's ready to be placed on the child's head. And so we use this simpler form of virtual reality with younger kids because it's lighter weight. The outer shell can be broken in session, and it's very inexpensive to replace. So it's not like a multi-$100 VR headset that if they threw it against a wall, a bad thing would happen. And it's also by using the iPhones, what we find is that for BCBAs and RBTs, they're very familiar with interacting with an Apple interface, and so it's very easy to use. And so that's what's on the child's head. And while the child is doing that, the therapist basically starts up the Floreo coaching application. And I'm going to screen share that right now. And so what you're seeing now is the Floreo coaching application. And so we've also selected the same child that we're working with. And again, this can be done both in clinic or in person or as a telehealth activity. So this might be, the family might be the one loading in the Floreo phone into the headset, putting it on the child, providing loose supervision of the child. Video conferencing is being used to establish an audio-video link between the therapist and the child. But the therapist is then firing up the Floreo coaching app. They're able to then peruse the catalog of Floreo lessons. They can also look at recommendations from the system. So in this case, we uploaded this child and created a profile for them, and it included some of the challenge areas through that profile questionnaire that led to recommended skill areas that we think are useful. If a BCBA has already gone in and developed a lesson, a VR lesson for the RBT, that would show up at the very top and be something that they can access. In this case, my test child does not have that already. And the therapist has full access to the catalog, so they're able to see everything going on. And then they can choose a lesson. So I'm going to choose one of the simplest lessons that's built around joint attention. And there's information for the therapist to come up to speed on the lesson. There's criteria on whether it's applicable. So in this case, this lesson can be used with nonverbal learners, so that's useful to know. And then once we start the lesson, a network link is made between the system and the coaching app. And so in the VR headset, the child is able to look around in the VR environment, and you're seeing a real-time view of what the child is seeing. Is to have a direct link to the child, even though they have a headset on and they're looking at something. So we give that to the therapist through the coaching app. They can see what the child is seeing, but they can also see a wider field of view. So the green bars represent what the child sees, but the therapist knows that the elephant is just to the right. And so if needed, they can guide the child behind the elephant. The blue bar is only available to the therapist, so we provide prompts, suggested language, status alerts, things like that. And then they're able to start the lesson when they're ready. And so in this lesson, we're just trying to teach that simple skill that if she points at one of the animals, we'd like the child to shift gaze and locate what's being pointed at. And so we start the lesson. The therapist is able to choose which animal. And so if I do elephant, she points at the elephant. And if we were doing this together, I'd be like, Brian, who's she? You're right, the elephant. Great job, you did it. So the therapist is still fully engaged with the child, but the child is in this fun environment, experiencing, this lesson that's clinically designed to help them with reinforcing joint attention. I can go through a set of animals, and I did this one fast, hopefully I'll pass. And because we're in a full 360 environment, when I say point to bird, the bird is actually hiding behind me. So she points behind me, and I have to actually fully turn around to find the bird hiding behind me. So the child can also get some spatial experiences that can be very different than in-clinic therapy because of the full 360 environment that they're in. When we're finished with the lesson, we get a readout on how they did. And I took too long talking to you about the elephant, so I didn't pass the threshold. And the system can provide recommendations on next lessons if you don't have a pre-built lesson plan. So in this case, we have a join a conversation lesson that we can try out in a moment. And then we're back here. Now, behind the scenes, that data is up in the cloud now. It can be viewed through our therapist portal. It can be shared with the BCBA. It can be downloaded as a CSV and uploaded into a compatible data collection tool. So there's lots of opportunities to use this in coordination with all the other data that's being collected outside of VR as part of a normal ABA portfolio. I'm going to show you one more lesson. And I want to highlight one of the strengths of Floreo, which is that, and I saw this firsthand as a parent, which is that children, as they receive therapy from adults, often develop skills with adults that they're not able to translate with other kids their age, right? So that's the challenge that you just see in practical experience. And so here, we're going to be able to work on conversational skill building, but with other kids. And we can use tween language. We can create expressions that they would see. So in this lesson, we can first set the visual distraction level of the lesson. That's also a neat thing that you can tweak, where you can start with low distraction environments initially with kids, and then you can ramp it up. And we're in a park table scenario. There's 3 kids sitting with me. They're peers to me. And I can now choose a subject to discuss. So I'm going to pick movies. And again, remember, the therapist is in control, so I can control the pacing here through the buttons. So I'm going to start the lesson.
I just saw a real cool movie last night. I love a good comedy.
I've seen the movie Spider-Man like 19 times.
And now we can ask the child and test their receptive communication. What's the topic they're talking about? The therapist can hear what the child says, or sign, or potentially they might take the headset off to use an AAC device, right? There's a lot of different ways. So we're very compatible with the breadth of children that an ABA clinic might be treating. And
Sure.
The therapist is able to then code, did they know what they're talking about or not? In other Q&A situations, we might say, and this kind of answers the question you asked earlier, we do add with prompting, without prompting as alternatives. So we do start to get to some of the granularities that can be captured. In this case, we'll say yes.
I'm going to see a movie with my big brother this weekend.
And in a moment, we're now going to test their expressive communication. The children face us. I, as the therapist, can say, okay, Layla, which is the name of our test child, what can we say to keep this conversation going? What can we talk about? And so now it's my child's turn to contribute. And we can take as long as we need to work on the skill. It might take a little while to express something that can work, so we can practice. And then we can ultimately code whether they were off topic or on topic. If I press off topic, they'll actually get a tween response, like an okay type response from the kid. Let them know that maybe we should try again. If they do on topic, they'll get some positive reinforcement.
Yeah, I know what you mean.
And then just like that previous lesson, we can end it. We're going to get data back on how they did on those 2 tasks. In this case, we passed both of them. That's up in the cloud, can be looked at, can be pulled down. We got a recommendation for their lesson. We can go to the home screen, pick something else. A typical session might include 4 or 5 of these lessons interspersed in other things that the RBP is doing. The last thing I'll just show you is that VR is a powerful environment for helping with regulation. So, obviously a lot of places have calming rooms. Often hard to replicate that in the home. It's hard to replicate that in schools. It's hard to replicate in tight real science. And so in VR, we can create relaxation environments. Allow the child to escape for a little bit. It can be used as a reward. It can be used as a warm-up. I'm going to show you one example here where a child a marimba surrounds them, and they're able to play the notes on the marimba and generate music by moving their head. This is often used as a warm-up to the more involved lessons, like what I showed you earlier, as a way to kind of get them acclimated to the environment. But we've seen it used as a reward for kids after a session, that you do the hard work and then you get the marimba, or the train station where you can see a train pull in and pull out. Obviously very popular with a lot of kids on the spectrum. And the result is that we're able to create these virtual calming environments without all the real estate demands that are placed on clinics. And so now screen share.
Yeah, that's amazing. So I had I had no idea that you were using kind of like these like virtual hotspots kind of to detect certain things. That I think is really, really interesting. You didn't show any, which I'm not saying you should have, but the one of crossing the street, um, does that put people more in a space? Like, do you have like spatial kind of hotspots as well? Like you had
We
visual ones, right?
Yeah,
Which would probably be
we tend to not introduce big space demands on the clinic.
mm,
So while they might have dedicated rooms, you don't need like 8x8 space, for
sure.
instance. So in those locomotion situations like the street crossing, or we have one on shopping at the grocery store, or that in those cases. Uh, you can just use your gaze to look at globes that initiate movement, but you can be doing it in place.
Okay.
And so we don't do what's called positional tracking in VR
Okay.
because
Okay.
it introduces a lot of workflow challenges for our customers. And so
Yeah.
we try to
Sure.
make it really simple so that it's easy to implement. Um,
So
uh,
if that child that was sitting in the safari truck there, if they got up and started walking, they
Nothing
wouldn't
would happen.
necessarily
Nothing would
move.
happen in the environment. Yeah, so it would look like the same as if they didn't move. It'd be we're only
Okay.
tracking the head change in that, and so we encourage that to just stay in seat. So so kids generally figure that out pretty quickly.
And
That's a future area that there's a lot of potential when you think of like OT
yeah,
scenarios like that. It's just implementing that in a clinic is still, I think there's still a lot of complexity to that. Do you really want a child running full speed in an OT gym with the headset
right.
on? Maybe not just yet. Maybe
Not
you need a
just yet. Yeah. Yeah.
So I want to show one last thing before from my slides because it's an
Mhm.
important one for practitioners, and that is that we've worked very hard around the reimbursement side, and so one area is that we got approved a new CPT3 code that went into effect last year that enables practices using such as the 971 codes to be able to claim as a practice expense the use of VR to augment the session. Some of our clinic customers are now using it, and it's starting conversations with payers on the value of what's happening, and it's happening in parallel to our FDA pivotal trial. By the end of this year, some really high credibility data on how ABA outcomes can be enhanced with the incorporation of VR. And so for ABA clinics, there's a great opportunity to not only use the system, but also help seed the future so that this can be recognized and rewarded by payers for those clinics that are looking to be innovative and incorporate new technology to improve outcomes. And so it's a really important
Sure.
piece of the larger strategy of how we're trying to really create something that's affordable and accessible and can be used where appropriate as much as possible. And separate to this, CMS just announced proposed new codes in the physician fee schedule for next year that once Floreo is FDA approved, which hopefully will be sometime next year, should open up new reimbursement codes that further create opportunities to incorporate this kind of VR treatment and to do so in a way that also enhances the clinic. And so we're really excited about all the potential that's coming up, including these new CMS codes. And that's the reason why we're also spending a lot of time not only working with ABA clinics, but also engaging the FDA on medical device approval.
Yeah,
I'm sure this contact information will be shared, but we'd love to hear from all of you. As was mentioned, Floreo is in over 130 healthcare clinics and school districts today. We have some great ABA partners today, and we'd love to add more. Our focus is on ABA clinics being able to leverage this technology, and we're working very hard on the FDA front to also create reimbursement that goes alongside that.
Yeah, that's crucial, right? I mean, we really need in order for people to use it, they need to get paid, and that's great that you guys are making efforts on that side as well. Your video seems to have frozen for me. I don't know if it has for other people, but maybe we can get a, yeah. See if we can, yeah, it seems like we have a lag happening. Vijay, can you hear me actually? Take that as a no.
Oh no.
Yeah, I think we lost him.
He'll come back on. I think he'll come back on because we have a bunch of questions actually.
Yeah, no.
The questions?
Yeah. I've seen a couple of questions.
Here he is. We
There he
lost
is.
you, but you're back.
I
Technology.
don't know what happened. Hold on. I should change
Yeah,
the camera.
there we go. Okay.
Oh no, where did I
So,
leave
yeah.
you guys?
No, you're fine. We got everything, got through everything about the funding sources, and then your audio dropped off and you cut off. But no, let's so back on track a little bit. The I think the funding source thing is crucial. That's great that you guys have decided to dedicate a good amount of time towards that, away from the technology side, which is kind of, you could build the biggest, best, greatest thing, but if no one can use it and no one can get, utilize it in therapy, right? It's about only as good as it could be. I want to take a step back to the device side of it. Something that you said kind of resonated instantly as a hurdle to jump over is putting something on a child's head.
Yeah.
What type of resistance do you get from that? Do you have protocols on what to do in those situations?
Yeah, great question. The biggest concern when we started the company, right?
Sure.
My kid is a sensory seeker, so less of a concern with him, but obviously many kids are highly sensitive, and I didn't know whether this idea would work at all when I was getting started. The good news is that we've run many studies now. We've had hundreds of kids in a research protocol and thousands of kids in out in the field using the product. And we have a half dozen techniques that we've developed for clients to use that really help acclimate the child to putting the headset on and using it. They range from watching a lesson first from the iPad, watching another kid go through it, starting in a lesson like that marimba lesson I showed, touching the child's thigh or shoulder while they're in VR to let them know that someone's there so that they can kind of understand the physical world from the virtual world they're in. So several different techniques. And what we see kind of practically speaking in the field is that, it's not surprising for between 20% to a third of the kids to have some initial hesitation to putting the headset on the very first time. But if you...
What surprised you? Has anything really surprised you?
Well, I'm surprised at how low, in the end, it's only like 5% of kids have a resistance to wearing the headset. And separately...
I thought it was going to be more.
Yeah, I thought it was going to be more too. And then separately, our customer Bancroft ran a study with the profound autism population, over 100 kids, and found 80% acceptance in that population. So, and they expected it to be flipped. They expected 20% to tolerate that. And so the acceptance of VR on the head is much higher. I think once they know there's screens in there, they get a lot more acclimated to being okay with it. Choosing the right content really matters. So you wouldn't want to put someone that's never put a VR headset on in a virtual roller coaster, right? And then it's part of, our job is to build content that's highly tolerated and enjoyed by this population. And so we're very focused on it. I can't, if you pull down a random VR application from the App Store, it's going to be hit or miss with the child that children care about. So, this content is designed for them. And so we take great pains to make it something that can work.
Yeah. So has that backfired at all? Like, have you now had resistance for them to not want to take it off?
Well, the therapist actually has a blackout button that they can initiate on the iPad to shut the headset down if they need to. So they have ways to end the session when they want. But look, I think, it's not different than any other implement used where, you go through the whole preference process. You find you have your bag of toys that you use as rewards, and sometimes those rewards are very powerful. VR can be the same way, but it hasn't been so problematic. And like I said, we have some very simple facilities to
Sure.
end the session and be able to pull them out of VR because of the synchronized coaching application.
Sure. Yeah, no, that's very smart. So the headsets obviously come with a lot of tech built in, especially around things like their internal cameras and things like that.
Mm-hmm.
Like, what are your plans for expansion, just strictly from like what's available to you from the hardware standpoint?
Yeah. So again, we have a simplified deployment using iPhones and these headsets that the majority of our ABA clients utilize. So those don't have a lot of the fancy features of the future possible, but we support the MetaQuest headsets and the ByteDance Pico headsets. Those have more capabilities. The one that we're particularly focused on is the retina level eye tracking today. So retina level eye tracking opens up the possibility of being able to do diagnostics and assessments on the child's eye gaze. There's been a lot of great research, including the technology we acquired from Cleveland Clinic called Autism Eyes, supporting the power of eye gaze tracking to provide a score around a diagnosis. This is being used by the company Early Tech right now out in the field. They have FDA approval, but it's also has potential as an assessment, as a lightweight way to, in a fully quantified manner, rather than relying on parent surveys, to be able to take data in the course of treatment and potentially create alternative data points to the Vineland or CARS and some of the things that are implemented as part of ABA clinics, or go alongside that as a secondary point. So those are things we're actively working on right now. So we're integrating the Autism Eyes technology into eye tracking based VR headsets, and in I think by early next year we'll be looking for beta partners on some of the ideas that we're implementing. Hand tracking is really interesting as well in these headsets. So there's outbound cameras that can track your hands.
Yeah.
And it opens up some of those occupational therapy, or even in the context of behavioral therapy.
Opening a door or picking something
exactly.
up. Or, yeah.
Brushing your teeth. Staying calm. We have lessons on, because this was such a fear factor in the community, we have lessons on law enforcement encounters for older kids. And we, today the police officer in that virtual lesson says, show me your hands. And we are heading toward a future where we'll be able to actually assess automatically in the VR environment, did they show their hands? Did they make other hand gestures that could have been interpreted as dangerous by the police officer? That's just one example, but yeah, so there's tons of opportunities where we could the nonverbal communication side.
Yeah, that's huge. I love that. So I guess you have your hands in a lot of different aspects. You've talked about the technology, the hardware, the research, the funding sources. What's your day-to-day? Like, where do you divide your time up?
Yeah, look, we have a great team that is working on all of these things. I love talking to customers. I love engaging with the people providing the services on the front lines who are making a difference every day. And so if I'm not talking to customers, we're always, keeping a warm line into investors to continue to fund the path we're on, which is to become FDA cleared, to have funding sources available to our customers so that they can make this clinical decision to improve outcomes, and that it fits their business model and fits the ecosystem of payers that they're in. And so we're working towards that to make big progress. And that involves a lot of communication with a lot of different parties that we're doing. And then I'm excited about some of the new products we're working on. So we have a exciting new capability around ADHD, which is highly comorbid with our autism population we care about. And so that's in trial with NIH right now, and it's co-developed with a research lab there. And so we're really excited about that. We're really excited about some of the practical applications we're looking at AI for right now. So we have two. One is around helping assist in picking the best lessons for a given child. And so we're looking at different modalities for what kind of data could be brought to the table by the client, and how we can get really smart about recommending the best lesson plan that can be used as a straw man by the BCBA to then personalize further. And so over 200 lessons is a lot to come up to speed on. And so whatever we can do to make that more efficient in the context of larger treatment plan would be really great for the workflow.
Now, do you need to be an FDA approved stage 2 or something device in order to give out recommendations like that? So you can kind of double dip a little bit on that FDA approval, right?
Yeah, so we yes and no, in that some of the things we do outside of the regulated context, as far as what claims we make, and then other parts we are looking for that full FDA approval to open up the reimbursement codes and to create it. And so it's we have a team that's working on all of the nuances of navigating the FDA processes and the benefits of going through those processes versus the efficiency of getting products out to customers as quickly as possible. And so it is a bit of a balancing act. The second area that we're looking at that is really exciting is around, we are using voice recognition. We have basically prototypes now using voice recognition on the VR headset to allow the child to converse with AI characters in the virtual environment that can actually do full back and forth conversations. So you can do practice trainings around how to invite a friend to sit next to you at the lunch table, or ask someone for a play date, or it's kind of some of those skills that are really hard for the kids but end up being vital towards their development. And those can also then be extended into, when you go to the young adult space, all the way up to job interview training or other things. So that's a really exciting area of development as well.
Yeah. Wow. You got a lot on your plate. And it's, you have a great platform. It seems like you got a really good base, and it's quite an expansive company, because you have to do the hardware, the software, the funding and payer source side, and the research and the development. And yeah, it's definitely a big feat you guys are doing, and you're successful. So congratulations so far.
Yeah, thank you. I appreciate that. And for ABA clinics, hopefully we make it as simple as possible, that, we're doing all of these things, but you can reach out to us and get a box. The box has the hardware in it. We provide the training. We have codes ready for you to use. They're not yet, paying out probably to the amounts that we want, but that's what we're working on right now.
Yeah, amazing. Christy, what type of questions do we have coming in?
I was looking at it, and a lot of them, Brian, you already asked, and I think everybody is just kind of interested in the same thing. But maybe a little bit more about you talked about ADHD and those other things. What about stuff like epilepsy or visual and hearing disorders or sensory processing? Have you had to kind of attack that yet? Or did you just say, well, it doesn't work?
Yeah. Well, I mean, I think a lot, the current product that's out there, which is not making an FDA claim, it's available for use as a tool by any therapist, can be evaluated by those therapists for any number of applications. It's not a medical device, so you can use it. And we do see it being used on a wide range. When you look at our emotional regulation content, for instance, that's not limited to autism. That can be used in a whole host of things. When you look at teaching someone how to cross the street or handling a bullying scenario, that has a wide range. And so we do see, especially the school district side, where they're not practicing as a healthcare provider, we see wide applications. Saying, I'm using it with a kid with OCD or schizophrenia, and we're like, great, not a medical claim. We're not that way,
But
you know,
I didn't ask that correctly. I'm sorry. Oh no, Vijay. Okay, he's back. What I meant was like, what if you have epilepsy?
Oh, sorry. Yeah, as a isolation. Yeah. So it's important to talk to your doctor if someone has epileptic conditions. I'm not a healthcare person, or an MD, but I'll say that what I have learned is that there's lots of different forms of seizures, and some are safe to use with VR, some are not. You have to consult your medical professional to kind of get that assessment, and then make a decision on that. And as far as visual impairments, we haven't really fully probably assessed what parts of the catalog are applicable or not applicable. But my suspicion is that there are many parts of the catalog that are applicable. When you look at that join a conversation scenario that I played as a demo, I mean, you could be visually impaired and still get a lot out of practicing how to listen to a conversation, understand it, and contribute to the conversation. Yes, the visual immersiveness adds a layer that's very important in the context of our product versus just watching a 2D video. But it's still, it's not just the VR, it's the interaction model of the therapist. It's the fact that the therapist is guiding the delivery of the content, assessing at different breakpoints whether they're able to achieve different defined tasks and goals, that data is recorded and available in the context of a protocol like ABA, and that you can then deliver the praise at appropriate moments to encourage the behaviors you want, right? So fundamentally, those things are intrinsic to the practice and can occur even if someone's not able to necessarily see all the content.
Right. And as a BCBA, I can tell you, we love things that add to our repertoire, but do not replace us. That's a really great aspect of it. I think the other questions that we had were a couple of them. One is just kind of about content and choice. And I think you did a really good job of sort of explaining how you've done a lot of research on it. You weren't just like, hey, let's talk about movies, but you really looked into what's important. Do you have any medical desensitization scenarios, like sitting in a dentist chair or getting your hair cut? Or
coming soon? Yeah, they're in mid-development right now. It's been a high ask. We have some coming out really soon that we're excited about. And we actually have one potentially coming soon from a third party that's licensing their content to us as well. So we are friendly to third-party VR content that we can have our clinical team assess and then bring in. So we have one partner today that is providing calming content, and we're about to add, I think, on that front as well. So yeah, that's a high ask. You didn't ask this, but the other thing that we have developed and we're interested in partners talking to us about is we work with Nicholas Children's Hospital out of Miami and developed staff training for ER doctors and nurses to interact with neurodiverse or autistic children in the ER and patient room setting. And so those are being used as part of the ER doctor and training and nurse training now at Nicholas. And we're eager to start building out that library for a number of scenarios, whether it's parent training or other types of opportunities where you can, in a dignified manner, show an autistic child exhibiting different behaviors and work through, in a multiple choice type curriculum format, what's the appropriate response if the child is acting this way or that way. And I'm particularly keen on that because I think there's also opportunities to help with challenges that are out there in the field with ABA, as far as like implicit biases depending on race or gender of the child, size of the child, things like that, being able to learn about the right ways to talk and act in the different situations.
That's great. That's really wonderful to think about all the different applications for it. I was thinking too, I was remembering that I used to work for Disney World, and I was at the Disney MGM Studios, and they had this thing where you could go in and it would simulate a haircut.
Yes.
And I remember, like, I don't know whether it was all sound or whether there was also some glowing involved, but it was very realistic. And that was in the
right. And we do deliver.
I'm like, yeah, you've got that technology.
Oh yeah, no, because the iPhone-based solution doesn't deliver this, but if you wear the Quest headset, the audio is in 3D. So that literal the snipping of hair right behind your ear that is pretty freaky the first few times for kids.
Yeah.
Can't be simulated in that environment. And so that would be a good one to work on.
Yeah. Wow. Well, so much. Well, thank you very much. I appreciate it. It was a great chat.
Yeah, thank you, Vijay and Brian. This was a really fun talk.
Yeah.
And
really
it was
good.
wonderful that you had such a great aha moment that can help lots of other children, Vijay. So thank you for that. Everyone, I hope you enjoyed this presentation. Please don't forget to mark your calendars for September 13th at 1 p.m. Eastern Daylight Time, when we're going to host another Motivity Future Focus webinar. And you can register for that now through Behavior Live. But thank you, everyone, for spending some extra time with us. Have a wonderful day.